Hello everyone, I am Dr. Prachee Kulkarni, fertility specialist, 49 Fertility Center. Going for an IVF treatment is an important and crucial decision. So today I am going to talk on how to prepare yourself for an IVF cycle. So first of all, let us start with selection of the clinic. So when you select a clinic for an IVF cycle, what all things you should look for? Definitely, nowadays we have to register the clinic with the ART bank and with the national registry. So a registered clinic is the first thing which you will be looking for. It should be a reputed clinic with the good success rate in the past, so you can find out from their past patients or from the reviews which, or directly after meeting the doctor. Some clinics even display their success rate. So this is important. What is the success rate of the clinic? The doctors which are treating you in the clinic, what is the qualification of the doctors? Usually these are reproductive medicine specialists, which is a specialist after gynecology. As a postdoctorate of gynecology, there is a special course which they have to undertake. So you should look for skilled and experienced doctors who are experienced in handling multiple and different kinds of cases, difficult cases. Also the embryology team, their lab setup, the availability of the latest technology, like having an RI witness system in the lab, which will prevent accidental mismatch of the gametes, or maybe having the facilities for embryo biopsy and PGT and other latest technologies. So the clinic which is well equipped with all these things in their lab, their doctors, their embryology team, that clinic will give you a better success rate. So this is about the selecting the clinic. Now, what is the next thing? When you decide for an IVF cycle, another second factor is again the cost of the IVF treatment. As we are aware, this IVF treatments are little bit on the costlier sides because there are many things which are involved. You are being given gonadotropin injections. If they are using recombinant injections, definitely the cost is slightly on the higher side. If in the lab they need to use different culture medias which are nurturing your oocytes, your sperms, your embryos. They need good quality incubators. They need to maintain the gas concentration, the temperatures of the incubators, and they need a lot of gadgets and technological support to maintain all this. So that is why the cost involved in IVF cycle. So understand the cost of the IVF cycle, understand how many days of injections you might require. So accordingly, you can plan your work schedule, how many days of off from work you may require. All those things you can discuss with your doctor. So usually an IVF cycle takes around 10 to 12 days of daily injections. In between these 10 to 12 days, there might be 4 or 5 visits to the clinic for performing scans. And on the last day, there will be an egg pickup procedure, which is done under anesthesia. So understand how the procedures are done, what kind of anesthesia is given, how you should go for the procedure, what can you expect on the day of procedure. So all those things you discuss with your doctor. So you will be prepared mentally and physically for an IVF cycle. Now coming to the most important thing, which is the determining factor in the success of an IVF cycle. So most important factor which determines the success of IVF cycle is the age of the female partner. So if you take the decision of going for an IVF cycle at right age, then the egg reserve, the number of eggs which we may able to retrieve, and the number of good grade blastocysts which we may get for transfer is good if you are less than 35 years of age. After the age of 35, there is a decline in the number of eggs, and also the quality of egg may deteriorate. So you should take the decision of going for an IVF cycle in time. Also, when it's not that after 35 we cannot do an IVF cycle for you, but then you may have to be mentally prepared that you may require multiple cycles and some pre-medications which your doctor may prescribe. It's important that you follow the medicines properly. So how will you prepare yourself for an IVF cycle is be financially ready, understand the finances, Nowadays there are options of EMI facilities or even loans for going for an IVF cycle. These are the things about the financial part. Diet wise or lifestyle wise, how will you prepare yourself is best thing is to have a BMI which is healthy BMI, which is less than 25, ideally between 23 to 25. If your BMI is on the higher side, try to reduce weight few months before your IVF cycle with proper diet and exercise regime. Also look into what all things you are eating. Avoid junk foods, avoid empty calories in the form of cold drinks, the juices, or even the junk food in the kind like butter or cheese which has many preservatives, ketchups. So all those things can be avoided. You have to follow a healthy balanced diet which is rich in protein and low in carbohydrate content. You should have more colorful fruits and vegetables in the raw form in your diet, so it gives you more antioxidants and vitamins. So all those things should start at least 2-3 months before an IVF cycle. If you are having habits like smoking or drinking, you should quit these things as early as possible, because both of these things are going to affect your gamete quality. So these are the things which are in your hand. What else can you do? If you have any other associated medical conditions, like if you have diabetes, if you have blood pressure, if you have thyroid problem, or any other medical issue or surgical issue which needs correction, get it done in advance, in time, so that when you start your IVF cycle as healthy as possible, the success rate of your cycle will definitely improve. So these are the things which you can try. So now you also have to understand your mental health is very important. So when we talk about the success rate of an IVF cycle, it is somewhere between 50 to 60% in the best case scenario. For individual cases, success rate will depend upon the multiple factors which are involved. How many male factors are present? How many female factors are present? How many modifiable factors are present? Suppose somebody has endometriosis, also age is on the higher side. Husband's sperms are also having count on the lower side, or the morphology issues. So how many factors are involved? Your success rate will depend on that. So based on your initial reports, please make a visit to the doctor before you start an IVF cycle to understand your individual success rate, and also to if any extra medications which may help in the quality of the gametes or taking care of the modifiable risk factors. So your mental health will depend on what is your expectation and how much you are in line with your doctor to understand your treatment. So if you understand what your success rate is somewhere around 30%, then accordingly mentally you can prepare yourself for the same. So it is important to discuss your reports with the doctor and understand your individual case success rate. So that is also important factor. So how to maintain a good mental health in an IVF cycle is, after understanding your chances, rather than anticipating the results, or rather than taking stress of the outcome, focus on your health, your physical health, your mental health. So having a regular exercise regime, or at least going for walks for half an hour, will help you in keeping your stress under control. Also, you try to read some books which will give you positivity, or listen to the podcast or any talks which are giving you positivity. Also, you can indulge in your hobbies, or sometimes you can go for some massages which will help you relax. So having all these things will help you in keeping your stress under control. When you are stressed, there are increased levels of cortisol hormones in the body, and which are definitely going to affect your cycle negatively. So rather than increasing your stress, try to reduce your stress by some form of meditation, yoga, pranayam, going for walks, and indulging into some activities which will help you relax. So this is about how to prepare for an IVF cycle. Try to follow these things. I think it will help you a lot in your IVF cycle journey. And I wish you all the best. and that you may get the success in your IVF cycle. Thank you so much.